Hey there, welcome back to our channel. Today, we're diving headfirst into a topic that affects millions of people worldwide, and especially children. It's an issue that can be itchy, annoying, and even a bit embarrassing. I'm talking about the tiny but troublesome creatures that cause countless sleepless nights for parents and kids alike. Head lice. Now, you might be thinking, why should I care about head lice? Well, stick around. Because not only are we going to demystify these little critters, but we'll also reveal essential information that every parent, teacher, and caregiver should know. So, hit that subscribe button and let's get started on this eye-opening journey into the world of head lice. Understanding head lice. Head lice are small, wingless insects that reside in human hair and feed on blood from the scalp. These tiny creatures are a common issue, particularly among children. They have a knack for spreading easily from one person to another, and eliminating them can sometimes pose a significant challenge. Their bites can cause itching and discomfort on a child's scalp, and the act of scratching can lead to potential infections. While head lice can be bothersome, it's important to note that they are not dangerous and do not transmit diseases. Contrary to a common misconception, their presence is not indicative of poor personal hygiene. Head lice simply require blood for sustenance and are indifferent to whether it comes from a clean or less clean source. To prevent further infestation and discomfort, it is advisable to initiate prompt treatment for head lice. Who is vulnerable to head lice? Head lice can impact individuals of all ages but tend to be more prevalent among children aged 3 to 11 years, as well as within their households. Children face a higher risk because they frequently engage in close head-to-head contact while playing together and may share items that come into contact with their hair. Indicators and manifestations of head lice. Despite their minuscule size, head lice can be visibly identified. Here are the key characteristics to watch for. Lice eggs, nits. These resemble tiny yellow, tan, or brown specks before they hatch. Nits are affixed to hair shafts in proximity to the scalp, where the optimal temperature fosters their incubation. While nits may resemble dandruff, they cannot be dislodged through brushing or shaking. Unless a child has a significant infestation, nits are often more noticeable in the hair than live lice crawling on the scalp. Nits typically hatch within 1 to 2 weeks, and once hatched, the residual shell appears white or clear while remaining attached to the hair shaft. This stage is when they are most easily discernible, as the hair continues to grow, moving the eggshell away from the scalp. Adult lice and nymphs, young lice. Adult lice are no larger than a sesame seed and exhibit a grayish-white or tan coloration. Nymphs, which are smaller in size, metamorphose into adult lice approximately 1 to 2 weeks after hatching. This life cycle recurs approximately every 3 weeks. Most lice feed on blood several times daily, and they can survive for up to 2 days off the scalp. Itching and scratching. Lice bites provoke itching and subsequent scratching. This itching stems from an allergic response to the saliva of lice. However, itching doesn't always commence immediately and varies based on an individual's skin sensitivity. Some children may take weeks before they start scratching, but they might still complain of sensations like tickling or movement on their scalps, appearance of small red bumps or sores. Extensive scratching can lead to mild skin irritation in some children, while others may develop a troublesome rash. Excessive scratching may even result in bacterial infections. Be watchful for swollen lymph nodes, glands, located on the back or front of the neck. Additionally, pay attention to red, tender skin that may exhibit crusting and oozing. In cases of a skin infection, doctors can administer antibiotic treatment. Are head lice contagious? Head lice spread easily from person to person, especially in group settings such as schools, childcare centers, slumber parties, sports events, and camps. These pesky insects cannot fly or jump, but they possess claws that enable them to crawl and cling to hair. Transmission primarily occurs through direct head-to-head contact and by sharing personal items such as clothing, bed linens, combs, brushes, and hats. It's important to note that pets cannot contract head lice or transmit them to humans, and vice versa. How to check for head lice. To inspect your child for head lice. Examine the scalp, the area behind the ears, and the nape of the neck. It's uncommon for lice to infest eyelashes or eyebrows. Detecting nymphs or adult lice can be challenging as they are typically scarce and agile. Look for nits affixed to hair strands close to the scalp. They may resemble dandruff or dirt. To differentiate, attempt to dislodge the tiny speck with your fingers. Nits remain firmly attached while dandruff and dirt can be removed. A magnifying glass and bright lighting can aid in the examination. The most effective method is to employ a fine-toothed comb on damp hair. After applying an ample amount of conditioner, comb through the hair in small sections, and scrutinize the comb for lice or nits. You can wipe the comb onto a tissue or paper towel for better visibility. If your child experiences itching and head scratching but you're uncertain if it's due to lice, consult your child's doctor or the nurse at their school or childcare center for a professional assessment. Do children need to stay home from school? In the past, children with head lice were often required to stay home from school. However, medical experts no longer advocate for strict no-nit policies. In most cases today, a child who has lice can attend school until the end of the day, receive treatment at home, and return to school the following day. While at school, it's advisable for children to avoid head-to-head contact with peers. Preventing head lice. To eliminate head lice and their eggs and to minimize the chances of reinfestation, follow these steps. Wash all bed linens, stuffed animals, and clothing used during the 2 days preceding treatment in very hot water, at least 130 degrees Fahrenheit 54.4 degrees Celsius, and then place them in the hot dryer cycle for a minimum of 20 minutes. Dry clean items that cannot be washed or seal them in airtight bags for a duration of 2 weeks. Vacuum carpets and any upholstered furniture in your home or vehicle, and dispose of the vacuum cleaner bag. Soak hair care items like combs, barrettes, hair ties or bands, headbands, and brushes in hot water or replace them. Advise children not to share these personal items. Because lice can easily spread within a household, check all family members and treat anyone found with lice to prevent reinfection. Encourage children to minimize head-to-head contact at school, for example during gym class, on the playground, or during sports and while playing with other children at home. Conduct regular inspections every 3 or 4 days for children who have had close contact with someone with lice, and treat those found with lice or nits close to the scalp. Additional considerations. Reassure your child that having lice, while embarrassing, can happen to anyone and is not a reflection of personal cleanliness or hygiene. These troublesome bugs can affect individuals regardless of their hair washing habits. Dealing with head lice can be frustrating, but it's essential to remain patient. Follow the treatment and prevention guidance provided by your healthcare professional, and soon your family will be free of lice. Well, that wraps up our exploration into the world of head lice. We hope you found this information both enlightening and useful. Remember, dealing with head lice can be challenging, but it's important to stay informed and proactive. If you or someone you know is facing this issue, know that you're not alone, and there are effective ways to tackle it. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more informative content. Feel free to share your thoughts, questions, or experiences in the comments section below. We're here to support you on your journey to a lice-free life. Thanks for watching, and until next time, stay lice-free and stay informed.